well today I'm going to talk to you guys about xylitol. Have any of you ever used xylitol products before? Gums, mints, things like that. We're going to learn about what it is, where it was discovered, things like that, and how to recommend them for your patients. So by the end of this class session, my hope is that you guys will be able to know the benefits of xylitol, as well as gain the knowledge about xylitol products and how to recommend those products for your patients and figure out where they can find them. And also some of the objectives for you guys is to identify 3 products that contain xylitol and be able to compose 5 benefits of xylitol, as well as identify at least 3 places that a patient of yours could purchase those xylitol products and be able to state the functional use of it. And also identify where xylitol is produced. You might be surprised some of the places that we already are getting xylitol from. So first of all, what xylitol is, it is actually a natural sweetener. It is derived from natural sources. It is a carbohydrate, and what it actually looks like is a white crystalline substance, and it looks a lot like sugar and tastes a lot like sugar, but it's actually better for you than natural sugar. Xylitol was discovered about simultaneously with the German and French chemists kind of found it at the same time, so they both got credit for it. In the late 19th century. It has been used for decades by the Soviet Union as the sweetener for diabetics, which we now also recommend for patients that have diabetes, that they can use the sweetener instead of using regular sugar, and it will still help them keep control of their blood sugar levels. Its dental significance was researched in Finland in the early 1970s when scientists showed it had significant benefits for dentists and dental practices and their patients. So where is xylitol found? We actually produce small amounts of xylitol in our bodies. It is found in our tissues, and we produce about 5 to 10 grams of xylitol every day. Some of the places that products that you find that contain xylitol are corn or corn cobs, hardwoods such as birch trees are common, and fruits. Some of the fruits such as berries actually contain a small amount of xylitol. Mushrooms, vegetables such as lettuce contain it as well. So even when we're not chewing the gums or mints that have xylitol as the main ingredient, we're still getting a little bit from these few items. So why do we want to use xylitol? Well, first of all, as dental hygienists, we want to prevent tooth decay. So we want to prescribe this to our patients to reduce the tooth decay. It has a delicious sweet taste, so that helps when recommending it for your patients. And it reduces the plaque formation, which will help with the buildup of calculus and things like that. So it will prevent that plaque formation in the mouth. And what is nice about it is it's 1/3 fewer calories than regular sugar. So again, it's great for diet as well as for diabetics who need to control how much sugar they intake for their blood. And it increases salivary flow. So those that have dry mouth, this will help. These products can be great for them, the mints, the gums that they can suck on, and it will increase their salivary flow. And it is 100% natural and safe. So if your patients are concerned about using it, it is safe for them to use. It's very convenient. You can carry the gums, the mints, it's in your toothpaste and other places. So it's just easy to use and very convenient. And it's enjoyable. Some of there. It takes commitment to do. You have to be willing and disciplined to use the products. This is very easy. It's chewing gum, which I'm sure a lot of you already do, or mints, and so kids will love it as well, so it'll be easy for us to recommend to our pediatric patients. How does xylitol prevent caries? It inhibits the growth of the bacteria that causes cavities. So the bacteria is not able to utilize xylitol to grow. So when it has nothing to feed off of, it's not able to grow. And over time, with xylitol use, the quality of the bacteria in the mouth changes. So fewer and fewer decay-causing bacteria survive on the tooth surfaces, and it has less plaque formation, and also the acidity level in the mouth is lower, attacking the tooth surface, so it decreases that acidity level in the mouth. So some of the products that contain xylitol, most often they are found in gum, mints, and candies that you can use. The way you want to look to see if a product contains xylitol is to look at the list of ingredients, and this will tell you whether or not there's xylitol in it. And for the most effective decay prevention, xylitol should be listed as the very first product or first ingredient. So if it's not, you're still getting some of that xylitol effect, but it's not going to be the most effective way to prevent decay or plaque formation, or some of the reasons why we would recommend it. You can also use xylitol nasal sprays if you prefer to spray it up your nose, and toothpaste. So that is used already twice a day, usually, so our patients there's xylitol toothpaste, mouthwashes, and also the sweeteners, like I talked before. So it can be a sugar substitute for cooking or baking. Instead of using the regular sugar, you can use the xylitol sweetener, and that's actually 1/3 less calories. So that will be better for your diet, as well as, again, an option for diabetics to use. Since they're really not supposed to have a lot of sugar, they can maybe substitute this. So where to purchase xylitol? The few places that you can, health food stores usually carry it. Xylitol companies, manufacturing companies usually have websites that you can purchase them on, so you can order them online. And they have many different websites and different products. You can try different things, and sometimes they even give away samples if you go online. I know I checked a few websites. If you go online, they will be willing to send you samples of xylitol products, such as gum, mints, or toothpaste, things like that. And some local grocery stores carry products that contain xylitol. It's not seen very often, but sometimes they do. But you want to make sure that, again, you check that label to see if it has xylitol in it for the most effective prevention of decay. Again, you want it to be listed as the very first ingredient. If it's not, it's still giving you the xylitol you need, but you want to make it most effective, so definitely make sure it's the first ingredient. So a lot of you might wonder if xylitol is safe, or your patients will be concerned about this. They probably haven't ever heard of it. So you can let them know that xylitol has been approved for safety by a number of different agencies, including the U.S. Food and Drug Administration. So that's a big one. The World Health Organization, Joint Expert Committee on Food Additives, as well as the European Union Scientific Committee for Food. So xylitol has been approved as being safe, a safe product for your patients to use. So make sure you do let them know that. And xylitol has been shown to have decay preventing qualities, especially for people that have moderate to high risk for decay. So when used as part of their overall strategy for decay reduction, it will cause decay reduction. And this also includes make sure that you let your patients know that they need to be eating, the other part, eating a healthy diet and having good home care as well. They can't just eat the xylitol products or use the xylitol products and expect that to be enough. They need to be working on their diet as well as their home care. So make sure that they always consult a dentist or hygienist to determine what will be beneficial for them. So how much xylitol should one consume? Xylitol gum and mints should be used 3 to 5 times daily. For the total of 5 grams is considered the optimal use. So the use of the toothpaste and mouth rinses are suggested 2 times a day. And just kind of know that as xylitol is digested slowly in the large intestine, it kind of acts like a fiber. So a large amount of xylitol, if you're going way over what is recommended, it can have a laxative effect. So just make sure that you stress what the appropriate amount is to have daily. Obviously, the amounts suggested for cavity prevention are far lower than the typical producing unwelcome results. So they usually shouldn't be a problem, but for those people that maybe want to up it or think they're just kind of like medications, they think they take more than what they're supposed to, it's going to work better or something, it actually can have a bad effect if they're not careful. The frequency and duration of exposure is important. Gum should be chewed for approximately 5 minutes and preferably right after a snack or meal. And mints should be allowed to dissolve in the mouth, don't chew them up. When it dissolves, that's how xylitol is dispersed in the mouth. So here are some of my resources that I used, so feel free to check out these websites. And the California Dental Hygiene Association had about 30-second video that kind of was sent out to the public to inform them about xylitol, so you can take a look at that video if you'd like. Other than that, thank you.